Hi, everyone. This is Heather Hodges. I'm an organizational psychologist. Welcome to my show. This is the place where we say I'm in to creativity, bold thinking, transformational growth, and meaningful conversations. I've been looking forward to this episode for a while. I'm excited to welcome my friend, Jay Duty, to the show. Jay, he's a visionary healthcare leader with deep expertise in strategy, corporate development, and operations. And he currently serves as the COO of Maxwell TEC, helping home health and hospice organizations thrive through tech-enabled care solutions. And Jay's career spans leadership roles in inpatient and post-acute care settings. And he holds a master's in healthcare administration from Trinity University and is a distinguished alumnus of Abilene Christian University. Jay, my friend, welcome to the show.
Hello. Hi, Heather. So glad to be with you. I'm great. You doing okay?
I'm doing great. Oh my gosh, brother. It has been months since I have been trying to get you to come on my podcast. So thanks for saying I'm in and for being here.
I am in. I'm in. And I don't think it's for me being stubborn, but I'm glad we got it on the books. So.
Me too. You know, I can just imagine a lot of our friends and colleagues are thinking, oh no, what are Heather and Jay going to talk about? How is this going to go? But it's going to be so much fun. And to get us started, I have a question for you.
Ooh, I like that.
You like it? What does it mean for you to say I'm in, to stepping into your full potential?
Oh, that's a great question. I love that. I think for me, saying I'm in is kind of raising your hand, and I think the execution of things in I'm in is what I'm really drawn to. There's all the leadership principles out there. There's a lot of wonderful things that we're going to talk about today, I'm sure, but at the end of the day, I think it's about will and passion. And so I'm in is like taking up the challenge, right? Saying, yeah, why not me, and jumping in. So
That's great. So why not me? Execution, being willing, and then having the passion.
Yeah, I think that's right. I don't know if it's the answer, but it's an answer.
It is an answer. No, that's good. I think so many of us hide from our full potential so that, just that thought of being willing and, having the passion to go for it.
Yeah, I had a mentor of a mentor one time that I heard a story about. It's back in the newspaper days. And she said yes to a job. Like, I can do that. And then she asked herself, like, I don't know if I can do that, but I'm going to figure it out. So I think that's kind of the I'm in thing, right? Like, just jump in and say, why not me, and keep moving.
Yeah. Yeah, we get ready by doing it. We can't always have all of that prep ahead of time. You learn by doing.
Yeah, absolutely. Absolutely. I think I've said that in my career a lot of times, and just like, oh, I don't know. I'm in. Am I in? I think I'm in. I'm in.
Let's go.
Yeah.
Well, Jay, you and I have been colleagues and friends for many years. We share an alma mater. We were just talking about that earlier with my producer, Caleb, who is also an ACU grad. And so I've been aware of your journey for many years. And you were put into or promoted into a leadership position relatively early in your career. And I'm curious, what is your leadership philosophy?
Oh, yeah. And I think, thanks for saying that. I was very fortunate in those early days to have people that, were willing to be mentor and just kind of let me say I'm in. So I think that's kind of a great story. Yeah. I always tell people, I think I've given this, to young folks coming into to any industry, but that happen to be in my industry. I kind of have these 3 axioms that I always have. I guess it's like a good sermon, right? It has 3 points. Or as it goes, like, how many points should a sermon have? Well, at least one, right? But 3 points is I've lived in the philosophy, and I tried to look and see where I got this. But I gave a discussion one time. It was tied to a pastor in like the 1700s. But we live under the shade of trees we didn't plant. So the idea of somebody's come before us and built something, and sometimes we're stewards of that. Sometimes we're called to build something of our own and be the planter of the tree that other people are going to live under the shade of. So that's kind of like an axiom that I've I always is I want to live under the shade of trees I didn't plant. For me in my life, I've had many people that have come before me that have kind of built that for me. My parents, mentors that I've had professionally, those kind of things. So that's kind of one thing I've thought about. I don't know if it's a leadership style, but it's kind of an axiom I try to keep in front of myself. And then I think it's important to leave a legacy. So I think that's do something that matters, do something that other people want to follow, do something that will last past yourself there too. So plant those roots deep, probably under the shade of a tree you didn't plant. But leave a legacy, no matter what that looks like to your family, your colleagues, and then do something that means something and has impact there too. And then the other one is why not me? And that stems from, and I said why not me earlier, just kind of without thinking, but that stems from a story whenever I was a hospital administrator, and I was in an associate administrator position interviewing for a COO position. And I guess it kind of has to do with imposter syndrome. I went to interview for this job as a COO, basically to put my name in the hat for, hey, I'm interested in moving up, I'm interested in growth, kind of what that looks like. And so I went in an interview for this position and I got it. And when I got it, it was kind of a little bit of a tiger by the tail. And I had a great colleague. Her name was Jane Thomas. I'll give her a shout out here. Jane was a chief nursing officer. She may not want to put her name to this, but I've always told her name out there. So I guess it's out there now. But when she became a chief nursing officer, she started as what she called a baby nurse. So she had grown up in that hospital, started as a nurse on the floor, got a director position, got a VP position, and then eventually became the chief nursing officer. And she said when she first got that job, she goes in, she sees her name on the nameplate, and it says chief nursing officer. And she admitted to me that she went in her office and she just bawled her eyes out for a little bit, thinking they're going to figure me out. I'm going to get fired. You're going to know I'm a fraud. All the imposter syndrome things there. And she said, I had a little cry, and she was a strong gal, so that's saying something for her to have a little cry. But she said, I just looked myself in the eye, like, why not me? They hired me to do this job. They expected that of me. They know I've earned it. So why not me? So getting this job, I kind of had that same thing of like, they're going to find me out. They said, yes, I can't believe it. Kind of a tiger by the tail thing. And I said, you know what? Why not me? So I tell young people, we live under the shade of trees we didn't plant, leave a legacy, and then tell yourself, why not me? And go out there and get it and do it and say, I'm in.
Yeah. Yeah. I love that, Jay. I love it so much. So, the 3 axioms, the 3 truths to live by. That first one, we live under the shade of a tree we didn't plant. You know what that reminds me of? Our mutual friend and colleague, John Freeling. When you used to go into his office, there was a drawing done by Jenny Lear of a turtle on a fence post on his wall. A turtle on a fence post didn't get there by themselves. And we live in the shade of a tree we didn't plant. And it's our responsibility to honor the past, honor the shade and honor that tree, but also to live fully and, step into our full potential under that tree. What does it mean to you to live in the shade of a tree you didn't plant right now in your life?
Yeah. I think a lot of that actually spins me to my dad a lot too. I feel like there's some legacy things that were left before me and my mom too, my dad who's passed. But I feel like there's work that's been done ahead of me. I'm in a company today that was a founder owner started business that they've allowed me to come in and help them run. And so, I feel very fortunate in that there's been trees planted, lots of work done, lots of great people that I get to come be a part of. And I've been in several organizations like that, right? I wasn't a startup guy at all, and have somewhat functioned like that now, but with the safety of, hey, I've had people that have gone before me and built something now that will, also does the things like impactful, leaves this indelible mark on the industry and that kind of thing. But I think for me that's been, walking into this role at Maxwell TEC has been very much that, right? As people have built something before me, and it's a nice big shady tree. And just even getting into this industry, there were people that had gone before me that kind of brought me into the fold on that. So.
Oh, that's good. Well, what about a legacy? What legacy do you want to leave, my friend?
Yeah, I think with this, and I'll keep it within your job question or the professional realm that you kind of asked before. I think it's have impact. I think it's it's a very tenuous time in the home health and hospice industry, which is where I am today. Meaning reimbursement pressures, staffing challenges, just people having to figure out how to do more with less. There's a lot of technologies that have rapidly coming in, and so just kind of weeding through the noise of what's out there. We're just being asked a lot to, help us make sense of this all and that kind of thing. So I think for me, leaving a legacy as it is professionally is doing something that's impactful, helping people be their best, providing subject matter expertise, those kind of things that, are all from others. I'm in one of those roles where, and I've been in these roles my whole career. I don't know what this says about me, of like, I'm not the one doing the thing. I'm not the one that's executing on the actual services that are driven, right? Like when I was a hospital administrator, I wasn't providing care to patients. When I was in strategy and M&A and in home health and hospice, I wasn't providing care to patients. I was, hopefully impacting and building a place where that was effective and helping drive, I think, a culture, helping drive a culture that was really focused on that too. And now, even so, I get to do that. I'm even detached from the services that are detached from the patient care. But my people are wonderful. My colleagues, that they're subject matter experts. And so I think for me, it's how do I bolster the right people to really make the connection? We do a lot of work in technology, but it's not absent of that. I talked to some people last week about everybody's got an AI solution. It's going to help automate things, and it should automate the right things, but that's not void of the human touch. In fact, it's quite the opposite. How do you automate the administrative tasks so that somebody can there give the human touch to taking care of patients? And so that's where my passion lies in that, especially even in the technology world, is because it's getting a bad rap for being unhuman. But I think we have Maxwell tech-enabled care. That tech-enabled piece of the care is what's important. I know that's a kind of an elementary thing, but I think it's fundamental and foundational.
No, but that's a good thing to call out. And I think you're right. I think that's the highest calling, the highest use of technology and even AI is do what administrative tasks, do what tech can do so humans can do what only humans can do. Yeah. And that is that person-to-person contact, that care that clinicians can give to their patients.
Yeah, and I think, Heather, where it's going to evidence itself is I had a really great conversation with some people I won't name here, but really great conversation with some former colleagues last week at a conference that we were talking about where it's going to evidence itself is in the outcomes for the patients, right? There's a lot of things that can be automated, but at the end of the day, how much are we improving the care of the patient by all that automation? Is it just taking away some pesky tasks? So there's some process measures that'll help for sure, and it'll make sure that things are documented well. And there's scribing that's happening ambiently, and everybody's got an AI solution. I have a whole thought process on that, but at the end of the day, the outcomes for the patient's going to get better. And I think that's where we have to pursue this, is like the care side of tech-enabled care. How do we pursue the tasks that actually make outcomes better, make it a better experience for the patient there too. And we're developing tools right now just in communication with the patient, because that's such a lacking kind of space in this industry, ironically, is just how are we telling patients we're coming, and how are we talking with them along the way when we're not in front of them, and how are we getting these touch points whenever we're not physically in front of them. And so I think those are the enhancements that are going to have the human touch too. So so I mean, stay tuned on that. I'm trying to develop this thesis about at the end of the day, how is it improving the outcome for the patient? And I think that's what the government and payers want to hear. I know we're talking specifically about this. I'm getting a little too granular, but that's where I think we've got to get is to improve care, which will also improve the finance piece and the documentation of the care. It'll be evidenced in those outcomes.
Yeah. No, but that makes sense. Though, even though you dive deep into that, the question was, what legacy do you want to leave? And that's it. It's impact. It's human impact. It's not just, okay, I want to, create all this tech, but it's about the impact for the patients and for your team. I heard that as well.
What's funny, Heather? I just now you reminded me of the question. If we were going to predict how this would go, I would imagine that we would get off in some conversation and not even remember what the question was. So you're exactly right. You're exactly right. It is the impact.
Yeah. Well, and then the third axiom that you gave me was why not me? So when have you said why not me?
Yeah. The biggest story was when I first got that COO job, and I kind of went in to tell the gal Jane that I was telling you about earlier.
Yeah.
I was like, hey, I interviewed for that job and I got it. And I was kind of like, I kind of made these eyes, and that's where we had that interaction. But it was, I think when I first got in there, I had about a month in transition, and that was like me telling me that myself that over and over again. I think that's it. I think, being a connector of people and culture, there's always a place for that. And so I've always leaned into that. It's like the why not me part is the people know how to do the thing. The people know how to do the thing, whatever the industry, whatever the impact is, but they need somebody that can help them and empower them to do the thing. And so, and collaboration. So, we started a journey, and I heard on your podcast with my boss, Jen, just talking about our new core principles, and the reason we've rebranded and those kind of things was to really take this tech forward approach. But the cultural axioms, the cultural core principles are the same: collaboration, empowerment, ingenuity. Those are things that are all, in fact, very human, and leaders of people, they have to pour into that piece. I don't care who you are. Even if you're looking at M&A and you're buying a company, you can look at the numbers, you can look at the earnings and margins, and make sure that the workflows look good and understand what technologies they have, and is this something that we can synergize and get some cost out of their current platform when it comes on. But at the end of the day, the thing you have to be cognizant of, and the make or break thing, is the culture that's there. A, is the culture good? B, is the culture something that needs to be improved upon? Or C, all the above, and we need to integrate those two, right? Which I think the latter is probably the most true in my experience. And so, I think when you look at the why not me piece, I think that's like, stay true to those leadership principles of, when you come into somewhere, what matters is how we're in the people business of healthcare. It's still going to take all the collaboration, ingenuity, and empowerment to go out and do that things, but you're bringing people together that have the expertise in that is really where it happens, where it all happens.
No, that's so good. And I'm so glad you brought up the culture piece, because I'm curious, you lead a team of creative innovators. And, this has been an area of my research, is looking at what are the cultural conditions, the cultural elements, leadership styles, behaviors that either nurture or hinder creativity. And I'm curious, what have you noticed and what has worked well for you from a leadership perspective to lead creatives and innovators well in this healthcare space?
Yeah, and I'll tell a story specifically, and it pertains to you. So, when you came to work with our team. Yeah, I know this is the part that's going to get fun. So when you came to work with our team, I was kind of like, okay, this is going to be great. People will love Heather, and she's going to do this speech for our conference, and our team's going to get the opportunity to kind of sit at her feet and work through some things. And you brought up the idea of Lego Play, and I was like, well, great, but how does it tie to like what we actually do? Because we're in the world of compliance and regulation, and there's not you don't want a nurse to be too creative in how she provides care, right? I mean, you want her to be providing it by evidence-based best practices and all of those things, and you got to do it within a regulatory environment that you've got to be compliant, and you've got to bill it properly and all those things. So I won't say I was skeptical, but I was like, okay.
You had questions.
Heather can always do it, and I believe a lot in culture. Heather and I have had the fortune of kind of being involved in that in multiple organizations now. And so, I thought about that, and I actually had one of my technical data guys, super sharp, and we did this exercise that you and Jen talked about on the episode there before, where we were kind of asking ourselves, we do this exercise, and we kind of ask ourselves what's missing and what's confused. We also ask what's wrong, what's working and what's not working. But, I was kind of espousing these things of, we've got some visibility issues in this area of, I don't have a dashboard or have anything that I can visibly see tying all our resourcing together. It's a kind of disparate data sources, and what does that look like? And so one of my technical data guys, so you would think is kind of thinking not on that, was the one who thought the most creatively coming out of that. And he's now looked at a tool that's going to unify all that information to allow us, and it's an AI solution, go figure. But it's a solution now that we can really have a handle on, the talent that we have and where to place it at the right time with our clients. And so, he took that. He heard me saying, this is the problem I have. And he kind of took the challenge that you put out to us, which is how do you think about innovation and creativity within yourself, and executed on that. And I called you and I was like, okay, skepticism broken, of all things, here's what it is. So, that was really a good learning we had on that. Is even in a space where you feel like you can't be creative, we're solving problems at the end of the day, right? We're providing best practice solutions, and sometimes that's not always. There's not a textbook, and if there was, we'd be out of a role. But there's not a textbook that you go and look up, section 1.4.6-2 to say like this is how I handle this situation, right? So yes, we have to think about that. We have to think about. One of my favorite stories in that is we did a Lean Six Sigma project when I was at the hospital, and it helps to be dumb. That's one of my greatest qualities. And so I walk in, it was operating rooms. I know nothing about operating rooms. Had some great relationships with the surgeons, had a good staff. We were doing an efficiency project. And at the time, it was patient goes in before surgery and in pre-op. They get rolled back into their room. They have their surgery. They get rolled to the recovery room. And so that triangle kind of happens, and the doctor kind of follows that, right? So the doctor sees the patient, and then they go into the operating room, and then they follow that patient into recovery. And it was simple, and I think other people, I didn't figure this out. It's been figured out on that, but I was like, it seems like there's a lot of wasted time in there. And so we had the doctor, after he would go see the first patient in the pre-op area, he'd go see that second patient, and then instead of going to the recovery room with that patient, he would then go see the next patient, and then go to recovery so he could see that patient. And then once he made that, we kind of broke the triangle. And so then that way it flowed better. And that kind of taught me a lot about kind of efficiency and how we move parts about. But it's like, okay, that's where a best practice comes in and efficiency comes in, where just you'll think in a little bit different creative manner of just like, we haven't always done it this way. Same thing with a supply room. We had a supply room that was like in the back corner because that's where you want to keep all the supplies, right? But it wasn't in the middle of the action. So we actually took an OR and gave up really valuable real estate of an OR that wasn't being used at the time because we weren't busy enough, probably because we weren't efficient, right smack middle of all that, so that all people from all around the corridor could come get supplies in the middle, and we could keep things moving. And we're able to cut our time. So there's a lot of things like that. If you'll just be a little bit creative, and it helps. I say that halfway in jest, but halfway is like to not have context and to look at it with fresh eyes and to be a little bit like of a head scratcher, like, why do we do it that way? That helps. And so we try to lean into our teams whenever they come in and they're new. And just like I told the story about somebody thinking creatively, innovatively on our team, like that was fresh eyes that just like, why don't we look at it this way? So, and even in a world with AI, and everybody says they use AI, right? I'm like, congratulations, me too. I use it probably 30% of my day. And I'm, of course, referring to ChatGPT and some other tools that are out there. But like, what are we doing with that? And I even think too small about what that can do, right? So when you think of innovation, I think of it as like, if you're just using it as a search engine and a research engine, like that's a good start, but this thing can really be doing a lot. So I catch some kind of side chuckles. And of course, the younger generation behind me that doesn't have this wonderful head of gray hair, they are thinking in that much deeper than that. So, and to me, that just spurs me on to start asking questions like, could it do something like this? And they kind of like chuckle with side eye, like, yeah, it can do that, and much more. And like, cool, tell me more. So, asking the right questions, and I use that phrase, tell me more, like, tell me more. Oh yeah, because then that just gets people rolling, and then the innovation and creativity kind of spills out.
Yeah, tell me more.
Yeah, tell me more. I don't even know what question we're on again, but I think that's how it happens. I think is asking questions.
Yeah.
You ask questions, people will live up to that. That and setting expectations. People typically live up to the expectations you set.
Yeah. No, but you are landing exactly where I have, what I have found in the healthcare industry when we're talking about creativity and innovation. And a lot of times we hear, oh, no, we can't get too creative. but then they're not thinking about what is the actual definition of creativity. They're thinking, no, we can be innovative, but we can't be creative. And you actually need creativity to be innovative, because creativity is just the production of novel and useful ideas that can lead to innovation, which is implementing those ideas to solve complex problems. And your example of the lean thinking in the hospital and the OR, I mean, that's fantastic. I mean, that's creative thinking. And you're using the lean methodology to get there. And I love that you came in with fresh eyes and said, okay, why are we doing it that way? That's a great question. Why are we doing it this way? And the worst answer possible is because it's how we've always done it.
Yeah. Or people say, my favorite has always been across my career, I'm just a nurse. Like, so I had nurse executives that I worked with that were wonderful. And they're like, well, I'm just a nurse. No, you're a nurse, but also you can think creatively and figure that out and innovate, because you know what it takes to get it done. The people that are detached from that don't necessarily understand that. And then there's just so many moving parts, right, in all of this, and coordination of care for humans is very difficult, and the communication piece gets lost in the wash. And, once you do that, what people aren't up on, they're down on. So if you're not communicating to the patient what's about to happen, what did happen, what's going to happen, what people aren't up on, they're down on. They're like, this is scary. This is not, I don't understand, or I'm not getting answers. Those kind of things happen too. So, you have to think about saying things directly to the people that need to know them in a timely manner. Of even just a question of, like, people love their home health. They love their hospice service. Hospice service, they always say, I wish I would have gotten to it earlier, or the family does, And home health, people are like, I had great care. My dad was an example of this. I had great care, didn't know when you were coming. And that's where we developed our Notify module of Nana Connect. Our technology is, just to know somebody's coming and when, and be able to have control to say yes or no, that works for me. Like, that's a lot to be able to be a partner in your own care there. And there's this huge void that people don't know. And we're asking clinicians at the end of a busy day to make calls for the next morning. Whenever they've had a long day, they're gotten back with their family, they're at the end of kind of their fire that they've had for a day, and then they're supposed to get ready to turn around and do it again the next day. So that's been a fun way to, help communicate to patients, and the satisfaction just goes through the roof whenever you
Gosh, the more I learn about Nana Connect, the more I like it. And, from the patient's perspective, but also, like you said, from the clinician's perspective as well. What a fantastic tool.
Yeah, and I think just the patients telling us how they're feeling, letting them be the one to report. There's all this idea about, we got to monitor this, we got all this data coming in, and somebody's got to watch it. That's good, but also let the patient tell us, how are you feeling? And if you were feeling, I'm a 5, and then now I'm telling you I'm a 3 or I'm a 2, like, got to do something about it. What do we do about that?
Let's take action.
The intervention is what matters, right? It's not the, like, oops, I missed one, rehospitalization. What could we have done to prevent that? It's not the patient's telling you they don't feel well, and how do you intervene? So, again, moving to execution, like we talked about.
Right.
So, yeah.
Well, let's zoom back out and talk culture again, because that's been a big part of our work together, our collaboration in the past, in former lives, but also now, getting to collaborate on that now. What would you teach, train, advise leaders, young leaders maybe, or new in their leadership journey, on how to build culture and why it's so daggum important?
Yeah, I would say it is. It's everything. And I would say, people want to be, this isn't about size, but people want to be part of something that's big. Let's go back to the word impact we've been talking about. People want to be a part of that. And in the business in which you and I have been colleagues in, we're in a decentralized mobile workforce, disparate household model. We don't come all to the facility. And this was my first iteration in healthcare, was everything happened within 4 walls. I didn't leave those 4 walls. Hardly ever. That was the reason I wanted to not be there anymore. But, that's where you have to think about, is like, you've got these empowered people, but they're scattered. And so how do you build culture in a mobile work environment? That is really tough, because you don't get that, hey, how you doing? How are the kids? How was soccer this weekend? That kind of thing that you get in other people. So I think people want to be want to know they're part of something bigger. And I think that's where, and you and I were a part of bringing those teams together to show them like there's this impact that you're having locally. It's happening all over the place. And so, letting people know they're a part of something that's impactful and bigger than they are is empowering, and it's everything. And I think, rowing together is a partner of ours, kind of their thing. I think everybody wants to know, like, hey, we're ready to stand. I always used to say back to back. Like, if you're fighting like a gladiator, you want to be fighting back to back of all the struggles and ills of the world, the industry, those kind of things. If you're having to worry about, like, is this person might get stabbed there, or are we all facing back to back with a common goal of where we're headed as we go out? Those are two different things. So it's, that collaboration. And, if you're going to have a multidisciplinary approach to treating patients, you've got to trust, and you've got to also just understand that you're part of a bigger picture that is impactful, but you've also got to do your job right in front of that person and make sure that person is your only person in a mobile environment like that. So,
yeah, it's a lot harder to build that kind of culture when everybody's dispersed and in their cars, seeing patients or going from account to account and not centrally located like you used to be in those four walls.
Yeah. And I think, like, a lot of the default is like, let's have a pizza party, let's all get together, let's wear a fun costume. I think those are all important and fun things, but I think the deep impact of that is they want to know that's being done in multiple places, and that you're having a purposeful and meaningful work is really easy to build culture around. So, teaching people that, hey, it's really important that person that you're taking care of is somebody's person. Like, my dad was a patient, when I was there. And so it was really important to me what therapist and, who was in my parents' home taking care of my dad, because that was the only interaction that mattered to my dad. The only way that my dad got to see that clinical environment was that one person. So, I think that's the thing, is like, I'm part of something bigger, but what I do matters, and I have purpose in it. So,
no, but that's a good call out that, sometimes when we think about culture, we do think about birthday parties and celebrations and cupcakes, and, those things are great. But when we talk about culture, we're talking about something even deeper. It's the values, the tone, the way we talk to each other, how we build trust.
Yes,
like you said.
Information and transparency. I mean, how many
surveys?
How many surveys do you do where it's like nobody ever, the inherent they, never tell me anything, or they make these decisions? And, that's what Jen talked about. We have an operations leadership team that we've really empowered, to go execute and do stuff and be directional. It's like, don't wait for me to tell you what to do. Feel empowered to go collaborate among you, to be, to lean into the ingenuity we were talking about. And do it with empathy. Like, all of our core values tie. Like, you can't talk with one or the other, but that's where it's like, I hate to say decentralized, but it's not a top-down ivory tower. It's, how do we look at that? They're going to know much more than I am what the things are that can be improved, and then how to execute on those improvements, as opposed to just like sitting back from a distance. So, the culture really is like empower. I've overused the word empower, and I have been recently professionally, is just, I want my people to feel empowered, not because I don't want to do work. That's not what I'm saying. It's just like, as a leader, sometimes like, I don't know, what do you think? Because they're touching the issue, so much closer.
No, but that's, I can cite my sources on this one, that autonomy and feeling empowered, that will build trust and, creativity and innovation and productivity faster than just about anything else. So I think you're using that word properly.
Well, thank you. I'm going to overuse it, but yes,
go for it.
Yeah.
Yeah.
I always kind of seem to latch on to one word, but empowerment seems to be the thing that's really resonating with me right now. And then collaboration's an easy one, right? Because, the strength you provide together is much stronger than somebody just trying to figure it out in their cerebral mind of, the best practice or that kind of thing. It's like, no, let's walk with people that have walked it before and talk to it. So,
yeah. I'm thinking about trust, and I'm thinking, I was just thinking to myself, was there a day, a time, a moment when you and I didn't have trust, and why? Like, I cannot remember a time when we didn't have that with each other, and I'm trying to think why.
Is this
This is not therapy. This is not therapy.
No, I was wondering if this was coming with a copay or something.
Yeah. How do you build trust so easily with someone? How did we do that as colleagues, as friends?
Yeah,
what do you
question.
think?
I think with us, but I think it's illustrative of, just people in general is, if you look at my profile, I'm optimistic and quick to trust. I think assume good intent is one of those things where, especially if people have the same purpose and cause, it's easy to do. And like, I know we're illustrating here, but for you and I mean, when you came in, you were brought in to really pour into our culture. Specifically, it was speaking, right? And we needed some help. We were getting on bigger stages, both literally, figuratively and literally. And we needed our folks to be really good communicators, whether it was to the whole idea of like to one, to few, or to many. You kind of walk that path of, and I think that's a sales thing that I heard one time, that you've got to know how to talk to one person. You've got to know how to talk to a few people and make impact. And then you get to talk to many and make impact. And so we had people that were escalating up there. And so we had a common cause to like figure that out. And we knew what a culture driver that was. And so I think that's where all of that emanates is we got to figure out, what impact we're going to have, what's our purpose. And then it's easier to just have that quick trust. And again, you might get burned by being too trusting too quickly as an individual. I over-index on trusting people, and that's burned me a few times, but it's helped me a lot more than it's burned me. And so, yeah, and people listening, I don't know what their take is on that. They may think that's naive of myself, but I think that's a better way to live. I think it's a better way to serve people. It's better. Certainly makes it a better culture and environment to work with. Is that trust piece of, like, I think you have good intent. I think I have good intent. Let's go.
Yeah. Yeah. You're right, though, is that, if you look at it from a psychological perspective, it's that openness. It's also that assuming positive intent and then sharing common values.
Yeah.
And so that foundation was always there.
And I've been me my whole life, so I've never taken myself too seriously. And I think that's why all of a sudden, like, the trust gets built quickly when you're approachable, when you're, kind of a little bit fun-loving, or maybe call it optimistic. But I think that when you're working with teams, transparency is a big driver of that, and vulnerability. And I feel like I'm parroting a lot of the things that Jen Maxwell talked about because we spend time together. But it's like, transparency, communication, trust, all of those things spill into each other. And when you can do that and being willing to admit your vulnerabilities and mistakes, and then for me, it makes decision much easier because I'll be able to throw out in the form of a question like, I'm thinking this, am I off here? And no, I think you're right. Or giving them to say like, no, you're blowing it. That's not even close. Like if you give people that you lead the ability to do that, the end product is going to be so much better.
Mm-hmm. Well, I think you have just the right amount of professionalism, warmth, humor, self-deprecation, and just authenticity. That's why I think you build trust so easily.
Well, you're kind. I think there's been times where, again, that's been good and bad in some things, but I appreciate you saying it. I'll take it.
Oh, man. Hey, right?
I gotta take the bad. I might as well take the good.
Yeah, take the good. Well, Jay, this has been such a fun conversation. But before I let you go, my research assistant, Percy the Penguin, has a question for you. Percy, are you there? Come on in, Percy. Fantastic. Okay, Percy. Oh, wow. Okay, I'm reading Percy's question. His first question actually comes from somebody you and I both know. Happens to be your boss.
Oh, no.
Jennifer Maxwell. No, she was one of my last guests. So you get a question from a former guest, a previous guest. So the question is, what has been your most favorite vacation and why?
Oh, most favorite vacation. Can I talk about my worst one? Let's see. I went on a recent one.
We can do both. Yeah.
I went on a recent one, so I'll use that as context. Had a chance to go with family and another family, and our boys that are both 11 got to go on a beach vacation and just have a really great time. It was in a foodie town in South Carolina, and it was just a blast. It was like one of those times was much needed. Like, I need a break. I need just to go do and be for a few days. So that's kind of a recent one. My worst one is probably more interesting, and it's before I had a kiddo, and I never took vacations. When I was, we didn't have a kiddo Tracy and I didn't have a kiddo for 12 years, I think 12 years, 10 years, something like that. So everybody's like, oh, that's great. Did y'all just travel? Like, no, I just worked all the time. It was dumb. But I'd gone on a vacation with my college roommates and their significant others, and I was like kind of told by them, if you take a phone call, I'm going to throw your phone in the ocean. We were at St. Thomas, beautiful, perfect white sand beach. We're surrounded by sailboats and crystal clear blue water and all of that. And two things happened on that trip. I think I'm at liberty to talk about them, but if not, here I go. One was kind of a sad situation that a granddaughter was driving a grandmother into the emergency room. And as she did, she herself had an epileptic seizure. She jumped a curb and ended up at a 45-degree angle through the stucco wall of my ER, which she landed about 8 feet from the brand new cardiac cath lab that we had just put in. So I'm getting pictures of this, and I'm like, this didn't really happen. Like, y'all are messing with me. Like, the internet was not as accessible as it is now. But I was like, they're trying to mess with me. So I called them, and they're like, no, this happened last night. So that was interesting on that vacation. The other thing was the hospitalists who saw 85% of our admissions within our hospital got bought by our competitor. And so it's like, what do you do? And people were calling, and board members wanted to talk. What do we do here? So it was hard to enjoy the white sand and blue water there. So I've been trying to make up for it ever since. So, but I didn't take advantage of that when I should. Everybody's like, oh, you were great. That's great. Before children, you were able to do that. I actually didn't do it. So.
Oh, man.
And Jen would ask that question because she's been on some pretty epic vacations recently. So I get where she's coming from.
Mm-hmm. No, that's a good question. The best one, though, and I think for me the best one was our most recent one. Always, whatever we're
exactly. Yeah, that's great. Yeah, for sure.
Yeah. Okay, Percy also wants to know, what is one question you would like to ask a future guest?
Oh, I like that. I've always wanted to talk to Percy and listen to your show. So I would say, have you ever felt imposter syndrome? And what did you learn from it? Is that two questions or is that one? I think we'll put a semicolon in there. Yeah, a semicolon. Yeah. I don't know that I can use a semicolon properly. I'm not sure.
Sit next to me.
I'll chat GPT. It's been a long time since I've taken copy editing, but I'll chat GPT and see what it tells me.
All right. So imposter syndrome. Okay, got it. That's a good one, Jay. I think that will spark some really insightful conversations. So thank you for that. And, thank you for sharing your wisdom, your insights, just all of your practical tools and vision. I think your passion for your work, for leadership, for patient care is just inspiring. So how can our listeners find you?
Yeah, I think the best way is email. Love email. Love to have a lot of it. Love to be inundated. No, I'm just kidding. But Jay at Maxwell TEC, TEC, Jay at MaxwellTEC.com. Reach out, please.
Awesome. All right. Well, we will list that in the episode notes, your email, as well as how to get to Maxwell TEC.
Yeah, well. And LinkedIn would be great too.
Okay, LinkedIn.
There too. Yeah.
You got it. Yeah. I see you on LinkedIn every day. Love it.
Yeah, we're there. Gosh. All right.
Well, Jay, thank you. And thank you to our listeners for joining us in this conversation. And if you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with somebody who could use a dose of creativity and inspiration. So until next time, keep saying amen to creativity, bold thinking, transformational growth, and meaningful conversations. May you be wildly creative in your life and leadership. I'll see you soon.